For personal injury patients at Soft Touch Chiropractic, an automobile accident does not only injure muscles, ligaments, joints, and nerves, it can also change how you live your life, interact with your family, perform your job, sleep, exercise, and enjoy the activities that once brought you happiness. While X-rays, MRIs, and physical examinations are important, they do not tell the entire story. Your recovery is measured not only by how much your neck or back hurts, but also by how your injuries have affected your activities of daily living, ADLs, and your overall quality of life. At Soft Touch Chiropractic, we believe your recovery should be documented completely so your medical records accurately reflect the true impact of your injuries. Why your story is important. After an accident, many patients focus only on describing their pain. They may say, "My neck hurts, my back is sore, my shoulder is stiff." While these symptoms are important, they don't explain how the injury has changed your everyday life. For example, can you still pick up your child? Can you sit through a workday? Can you sleep through the night? Can you enjoy your hobbies? Can you drive without pain? Can you perform household chores? These changes are medically significant and should become part of your treatment record. Your injuries affect more than your spine. Following a collision, injuries often interfere with every aspect of life, including physical function. You may notice difficulty with walking, standing, sitting, driving, bending, lifting, housework, cooking, shopping, exercising, childcare. Even simple tasks may become exhausting. Work performance. Many patients report missing work, reduced productivity, difficulty concentrating, increased pain while working, inability to perform physical duties, reduced hours, career limitations. These changes help document how the injury affected your normal life. Emotional health. Physical injuries often produce emotional consequences. Many patients experience anxiety, fear of driving, frustration, irritability, depression, isolation. Mood changes, reduced self-confidence. These feelings are common after traumatic injuries and deserve attention. Fatigue and energy. Pain places constant stress on the nervous system. Patients frequently report feeling tired all day. Low energy, difficulty staying motivated, reduced endurance, increased stress, less interest in activities they once enjoyed. These symptoms often improve as healing progresses. Family relationships. Injuries rarely affect only the injured person. Family members often notice changes such as less participation with children, reduced intimacy with a spouse, increased dependence on family members, missing family events, needing help with daily tasks. These changes can significantly affect quality of life. Social activities. Many accident victims stop participating in activities they once loved. Examples include sports, hiking, church activities, gardening, dancing, traveling, playing with grandchildren. Community events. Recovery means regaining these important parts of life whenever possible. Sleep and appetite. Pain commonly disrupts normal body function. Patients often experience difficulty falling asleep, waking frequently, sleeping fewer hours, sleeping in uncomfortable positions, poor appetite, emotional eating. Weight changes. Sleep is essential for healing, so these changes are important to monitor. The most important question. One question often tells the entire story. What is your greatest joy in life and how has your accident affected it? Your answer is unique. Perhaps it is playing with your children, holding your grandchild, hiking, playing golf, gardening, dancing, working on cars, traveling, going to church, exercising, caring for your spouse. An accident may temporarily or sometimes permanently take away that joy. As treatment progresses, we also want to know, when were you able to start doing it again? How much could you do? Did your pain limit you? Have you fully returned to normal? These answers help demonstrate your recovery over time. Keep a daily recovery journal. One of the most valuable things you can do is keep a brief daily diary. It only takes a few minutes each day. Record your pain level, activities you could perform, activities you could not perform, sleep quality, emotional state medications taken, work limitations, family activities, exercise tolerance, improvements since yesterday. This diary helps refresh your memory during reevaluations, improve the accuracy of your medical records, help your healthcare providers understand your progress, provide valuable information for your attorney when appropriate questions we may ask during your care. Throughout your treatment, we may ask questions such as, compared to before the accident, how much do you now rely on others for help? What daily activities have become difficult? How has the injury affected your work? What hobbies have you stopped doing? How has your energy level changed? Have your stress levels increased? How